Hello and welcome to my presentation on Medicaid. I decided to cover Medicaid because I have personal experience with being covered by Medicaid, and because I feel that it is an invaluable resource to U.S. healthcare delivery systems, and I want to see it improve and grow. So I wanted to begin by discussing some of the history of Medicaid. Um, President Harry S. Truman of the United States had initially planned to implement a national health insurance program, but because of the political climate of the time, he was unable to get it passed by Congress. As a last-ditch effort, he did figure out how to pass a Medicare, Medicaid, and children's health insurance plan. And this proved to remedy health disparities that were present at the time and some that continue to be present today. In order to please those who were very anti-communist and very anti-socialist and that were opposing of the National Health Insurance Plan, these programs would be funded jointly by the federal and state government. So who is Medicaid for? Well, Medicaid is for anyone who is in need, really. Definitely low-income individuals, people who are out of work, pregnant women, children, the elderly, people with disabilities, whether they are intellectual or physical. And they are for people who are in the entirety of the United States or the District of Columbia. As of right now, there are currently 76,289,951 people covered by Medicaid total in the United States. So because Medicaid has been around for a really long time, there have been many efforts to continue its progression and improval so that it can continue to be relevant to healthcare today and it can continue to meet the needs and requirements that it needs to today. In order to make amendments to Medicaid, a state needs to send a state plan amendment to the Center for Medicaid Services so that it can be reviewed and receive approval or denial. This enables the standard for states to abide by federal rules and regulations, but it also entitles them to seek matching federal funds for programs. So in order to review the effectiveness and the efficiency of the funds that are allocated to each state by the federal government, the federal government conducts access monitoring reviews. These reviews analyze data and determine the efficiency of funds provided. They are conducted by each state every 3 years to monitor access to primary care physicians, dental care, behavioral health, obstetric care, and other services that need to be accessed by the people in the state. All of the data that is accumulated has to be submitted to the Center for Medicaid Services, and whenever a state is attempting to reduce their rates or restructure their services, they must submit additional data and services to showcase that access to these vital programs will not be compromised over 3 years. One of the major outreach initiatives created by Medicaid is support with enrollment. The Center for Medicaid Services provides fact sheets with images for Medicaid services. These fact sheets come in English, Spanish, American Indian, and Alaska Native. And they help provide a clear representation of the services and how exactly someone can sign up because they have the website, they have email, they have phone numbers listed. Medicaid then continues to support through helping enrollees access care. This helps individuals that are enrolled to establish regular care, and they also promote preventative care. And another outreach initiative that Medicaid partakes in is the Living Well Toolkit, which focuses on preventative services. Inside the toolkit, there are materials which are customizable, and they have information about diet, exercise, when to seek care, and other things that people should be aware of. These materials are also customizable so that they can reach people through many outlets such as social media, posters, billboards, and fact sheets. So how does Medicaid manage care? Well, they have 4 different types of managed care options for states to contract with. These options are MCOs, PIHPs, PAHPs, and PCMEs. Um, all of these options are overseen and audited for quality by the Managed Care Quality Organization. These oversights include the developing, updating, and drafting of quality care strategies. And performance is also measured through external quality review. On May 3rd of 2023, the Center for Medicaid Services proposed a higher standard of quality review. This would improve access to care and the care offered. A final rule of this quality review will be offered sometime in 2024. So this brings us to the question, is Medicaid functioning equally nationwide? Well, in a study that was conducted for preconception, prenatal, and postnatal care in the states of Oregon and South Carolina, they found that people who were getting pregnancy-specific Medicaid, meaning that they weren't covered until they were pregnant, were not receiving the same amount of visits and care as people that had Medicaid before becoming pregnant. This is alarming because that preconception care is vital in producing better birth outcomes and health outcomes for the mother as well as the infant. So when we look at the numbers here, we see that in South Carolina, individuals received 79% more visits, and in Oregon, they received 29% more postpartum visits. And then when we look at those preconception numbers, they're even more staggering because in South Carolina, people received 450% more visits and care, and in Oregon they received 200% more visits and care. Luckily, there are efforts to improve this through the American Rescue Plan Act of 2021, which is supposed to help improve those postpartum visits that many of the pregnancy-specific Medicaid families were missing out on. Some other inequalities have been noted when we investigate Medicaid disparities. Most notably, adults who are racially ethnic and belong to minorities are having difficulty receiving the care that they need in treating their autism spectrum disorder. However, adults who were white and diagnosed with autism spectrum disorder were having less difficulty receiving the care and treatments that they need. Studies like this allow us to critically analyze just who Medicaid is covering, how they are covering them, and where they need to improve. At the time of the study, there were no specific reasons to explain these disparities, but they concluded that they believe systemic racism has a lot to do with it. In order to address health disparities that prevent people from seeking the care and receiving the care that they need, the Center for Medicaid Services has developed a quality improvement program, and what they do is they direct initiatives to improve the quality of health care in the areas of focus that I listed prior. Quality improvement measures quality of care against the Center for Medicaid and Child Health Insurance Program Services core standards. This means that in every state, when they are being assessed for quality improvement, they are all measured against the same standards. This introspective look into Medicaid helps the organization as a whole be aware of its shortcomings and promotes an abundant effort towards resolving issues of disparities and inequalities in relation to eligibility, coverage, and treatment. Quality improvement initiatives are spreading and contributing towards improving health outcomes with tools, services, and expert support. Some areas of focus for quality improvement are maternal and infant health, well child care, foster care learning collaborative, care of acute chronic conditions, behavioral health care, dental and oral health care initiative, preventative care, long-term services and support, and Medicaid quality grants. Once quality initiatives are put in place, they need to be assessed so that we can see how effective they are. Recently, a study conducted in 2021 measured spending efforts by Medicaid to provide home health and community health for adults with intellectual and developmental disabilities. In the 35 states that were surveyed, research indicated that spending efforts mostly contributed to environmental modifications so that people with intellectual and developmental disabilities were able to be safe, healthy, and have an increase of their overall welfare, whether it be at home or in an outside environment. Total spending for all 35 states was $68.8 million. These types of research studies allow Medicaid providers and the Center for Medicaid Services to better understand how much funding to provide for healthcare services in the future. When we talk about numbers like 68.8 million, it begs the question, where are those funds coming from? Well, Medicaid is jointly funded by the state and federal government. The state is responsible for funding a portion of health services, and the federal government pays for another portion of health services through the Federal Medical Assistance Percentage Program. In order for states to receive more or less funding or alter their funding in any way, they must submit a state plan amendment to the Center for Medicaid Services. In order to further address health disparities that occur, such as those that were encountered in a 2016 Massachusetts study that reviewed postpartum visits of women who were postpartum and covered by Medicaid, and women who were postpartum and covered by private insurance were not receiving the same amount of care and the same amount of postpartum visits. To address concerns like these, primary care-focused delivery system reform is gaining traction, and it is gaining traction through an organization which holds Medicaid accountable to provide essential health care, the Medicaid Accountable Care Organization. Implementation of the Accountable Care Organization was successful in minimizing differences of healthcare provision, further increasing the likelihood of equal health care for all Americans. The Affordable Care Act contributed to strengthening the integrity of Medicaid by removing providers from Medicaid that have been removed from other programs. This means that individuals whom are covered by Medicaid receive the same quality of care as individuals that are covered by other programs. The Affordable Care Act has also suspended Medicaid funding for programs that are under investigation for fraud. These efforts allow Medicaid to remain a structurally sound healthcare system in the United States alongside the Affordable Care Act. So, what is the future of Medicaid? Well, Medicaid is working closely to monitor its spending and its providers to create positive health outcomes for vulnerable and low-income populations. Dismantling health disparities among individuals in our country, and growing efforts to ensure accountability for providers and the system itself. This is evident through programs like the Quality Improvement Program and the Accountable Care Organization. We also see this when we take a look at the Quality Assessment Program, which carefully analyzes how the funds are spent and how well they are being spent to meet the needs of the individuals and the programs that need them. Most interestingly, in the post-pandemic era, Medicaid is developing a standard in which crisis coverage is more easily accessible after the COVID-19 pandemic. This would provide continuous ongoing coverage during any time of crisis. These circumstances include public health emergencies, climate issues, and economic devastation. This proactive approach will contribute to better outcomes for vulnerable communities when we are faced with such issues. I had already felt that Medicaid was an extremely vital key element to healthcare in America. I know people who've been covered by Medicaid, and I myself have been covered by Medicaid before, and I think it is absolutely necessary. I think without Medicaid, we would be in devastation. Reflecting on what I've learned about Medicaid and the organization itself, this just reinforces those thoughts and those beliefs about healthcare in the United States and Medicaid. As a system, Medicaid operates reasonably well, but there are deep-rooted flaws, such as systemic racism, preconception care, and other disparities that need to be continuously addressed. These are only two distinct issues that need to be resolved to create a nation with better health outcomes. This awareness is a step in the right direction. Other initiatives, such as proactive solutions to crisis, show us that Medicaid is investing in the well-being of the people that it covers. Furthermore, the Affordable Care Act has strengthened integrity of Medicaid by ensuring that healthcare resembles a more universal approach. Ultimately, a national health insurance plan would resolve some of the gaps created in the jointly funded system that is currently in place. I think it is important that we continue to strive to make Medicaid an equal health program when it is compared to private insurers and the Affordable Care Act.